Welcome to the Deep Dive. Today we're venturing into veterinary cardiology,
That's right.
specifically looking at a condition called atrioventricular valve dysplasia, AVVD for short.
Mm-hmm.
We've got some really interesting information here from medical text, breaking down this congenital heart issue.
Yeah, it's quite detailed stuff.
And our goal really is to pull out the key things for you, how it affects the heart, what it means for, animal health.
Exactly. We're going to explore how these critical valves inside the heart can develop differently right from the start,
Okay.
and the knock-on effects this has sort of throughout the whole circulatory system.
Like problems with the foundations of a building.
That's a great analogy, yeah. If they aren't quite right from the beginning.
Okay, let's get into the basics then.
Yeah.
So the text basically say AVVD is congenital, meaning it's there at birth.
Right, born with it.
And it affects either the mitral or the tricuspid valve. These are like one-way doors in the heart, making sure blood flows the right way.
Perfect way to put it, yeah, between the chambers. And AVVD means one of those doors, maybe both, isn't built quite right.
Okay, so it could be one or both.
Mm-hmm. The texts emphasize that. And depending on how it's abnormal, you get different problems with the heart's pumping.
Right, the sources mentioned valvular insufficiency, stenosis, and something called dynamic outflow tract obstruction. They sound pretty serious.
They definitely can be. Insufficiency, that's your leaky door. Doesn't close properly, blood leaks backward.
Okay.
Stenosis is the opposite. The doorway's too narrow, harder for blood to get through.
Right.
And dynamic outflow tract obstruction. That one's a bit more complex. It's where part of the valve actually gets in the way of blood leaving the heart.
Wow. And the texts also say AVD isn't always alone. It can come with other heart defects.
That's a key point. Yeah. Sometimes you see it alongside issues with the aortic or pulmonic valves, the ones leading out of the heart.
So potentially a combination of problems. Let's break down what happens with each type. Valvular insufficiency, the leaky one. What's the immediate effect?
Well, when that valve leaks, the chamber getting the backflow, the atrium, it has to stretch
Okay.
to hold the extra blood. And over time, this makes the main pumping chamber, the ventricle, work harder and get bigger. It's called eccentric hypertrophy.
The heart's trying to compensate.
Exactly, trying to keep up. But eventually, this can wear it out, leading to congestive heart failure, CHF.
Where it just can't cope anymore. And where the congestion happens depends on which valve is leaky, right? Mitral valve on the left.
Means trouble in the lungs, pulmonary congestion.
Fluid buildup. And if it's the tricuspid valve on the right?
Then it's systemic congestion,
Right.
affects the rest of the body. It's all down to that chronic volume overload and the high pressure in the atria.
Makes sense. Okay, what about stenosis, the narrow doorway?
So stenosis also makes the atrium behind it get bigger and thicker, working against that resistance.
Right.
But interestingly, the ventricle that's supposed to receive the blood might actually end up smaller than usual. That's called hypoplasia.
Like the room doesn't get used enough because the door's too small.
Exactly. Good way to think about it. And with tricuspid stenosis on the right side, that narrow opening means pressure builds up in the right atrium.
Mm-hmm.
If it gets high enough, the texts mention pressures over 15-20 millimilli HEG, you can get that systemic congestion again.
And for mitral stenosis on the left.
Similar idea, but the pressure backs up into the lungs' blood vessels. If pulmonary capillary pressure goes over, say, 25-30 millimilli HG, you get fluid leaking into the lungs' pulmonary edema.
Okay.
And something really common with mitral stenosis is high blood pressure in the lungs, pulmonary hypertension.
That sounds like a major complication.
Hmm.
The source also mentioned something about a hole between the atria, like an ASD or PFO.
Yeah, that's important. If you have tricuspid stenosis creating high pressure on the right side and there's an opening between the atria.
Like a shortcut.
Exactly. That high pressure can force the oxygen-poor blood from the right side across to the left side.
It bypasses the lungs.
Right. It goes out to the body without getting oxygenated properly, a right-to-left shunt.
Not good. Okay, lastly, that dynamic outflow tract obstruction. How does a valve problem block blood leaving the heart?
It usually involves the mitral valve.
Yeah.
The texts explain that sometimes the front flap or leaflet of the valve is positioned abnormally. So when the heart contracts, this leaflet actually gets pushed towards the wall, separating the ventricles.
And partially blocks the exit.
Precisely. It obstructs the outflow from the left ventricle.
And how does the heart react to that?
It responds by building more muscle in the left ventricle wall, making it thicker. That's concentric hypertrophy.
So the muscle bulks up to push past the blockage.
Yeah, the harder it has to work, the thicker it gets. The severity of the thickening usually matches how bad the obstruction is.
Got it. So AVVD clearly messes with the heart's mechanics. Which body systems feel the effects most? Cardiovascular is obvious, I guess.
Top of the list, definitely. We've talked about the inflow obstruction from stenosis and the volume overload from insufficiency.
Leading to high venous pressures.
Right? Either pulmonary or systemic, depending on the valve. And if the defect's really bad, the heart might not pump enough blood, overall low cardiac output.
And that concentric hypertrophy we just mentioned with the outflow obstruction.
Mm-hmm.
Respiratory system, too, especially with left-sided mitral valve issues.
Yes, absolutely. Pulmonary edema, that fluid in the lungs, is a direct consequence of mitral insufficiency or stenosis.
And pulmonary hypertension often comes with mitral stenosis, you said.
Very common complication, yes. Adds more strain.
Okay, this was interesting. The texts mention the neurologic system could be affected, too. Fainting, collapse.
Yeah, especially during exertion. If the heart condition is severe, the low cardiac output can cause blood pressure to drop suddenly.
Leading to collapse.
Right, and specifically with that dynamic outflow obstruction, collapse is often linked to dangerous irregular heartbeats from the ventricle's ventricular arrhythmias.
Wow, that's scary. Okay, let's shift gears slightly.
Huh.
Why does AVVD happen? Genetics seem to play a role according to the sources.
They do, yeah. It's quite clear for tricuspid valve dysplasia in Lab's Labrador retrievers, it's inherited as an autosomal recessive trait.
Meaning they need a copy of the gene from both parents.
Exactly. Get one copy, you might be a carrier, but probably won't show signs. Get two, and you likely develop the condition.
But for other breeds?
It's less clear. The texts are careful to point out that we don't really know the heritability or the exact inheritance patterns in many other breeds or for mitral dysplasia generally.
So genes are involved sometimes, but it's not the full picture everywhere. How common is this condition?
Well, the data suggests it's actually pretty common in cats. One study cited found it in like 17% of congenital heart defects reported in cats.
That's quite high.
It is. But interestingly, it seems to be diagnosed less often in dogs.
Huh? Wonder why that is. Okay, so who gets it? The signalman, as they call it.
Yeah.
We know dogs and cats.
Yep. And breed-wise, we touched on labs for tricuspid dysplasia. Also German Shepherds, Great Pyrenees, maybe Old English Sheepdogs.
Yeah.
And very common in cats. For mitral valve dysplasia, the list is different. Bull Terriers, Newfoundlands, Labs again, Great Danes, Goldens, Dalmatians, and Siamese cats.
So labs can get both types.
Seems that way. And mitral dysplasia might even be the most common congenital heart defect in cats overall. It's often seen alongside hypertrophic cardiomyopathy in cats too.
Interesting connection. What about age? When do signs usually appear?
It depends on how severe it is, but typically within the first few years after birth.
And any difference between males and females?
The texts note that males seem more likely to actually show signs of heart failure. Doesn't necessarily mean they get the defect more often, but they might progress to failure more readily.
Okay. Now, for owners listening, what might they actually see at home? What are the historical findings?
Probably the most common thing owners notice first in both dogs and cats is exercise intolerance. Just getting tired easily.
Okay.
With severe tricuspid dysplasia, you might see a swollen belly abdominal distension, maybe weight loss, or the pup or kitten just isn't growing right, stunting.
And for mitral dysplasia?
More likely labored breathing, maybe faster breathing.
And collapse. Fainting.
Yes. Syncope or collapse can happen with really severe stenosis or that outflow obstruction, or if they're associated arrhythmias or just heart failure from a bad leak.
Definitely signs you wouldn't ignore.
Yeah.
So, what would a vet find during the physical exam? Let's start with mitral dysplasia again.
Okay, the classic finding is often a heart murmur. It's usually holosystolic, lasts through the whole heartbeat squeeze and loudest over the left apex, the bottom tip of the heart. If it's severe, the vet might feel a vibration, a thrill, or hear extra heart sounds like a gallop rhythm.
What about stenosis?
With mitral stenosis, you might hear a soft diastolic murmur when the heart relaxes, but the texts say many animals with stenosis actually don't have an audible murmur, so you can't rely on that.
Okay.
And if it's the dynamic outflow obstruction, you'd likely hear a systolic ejection murmur, one that gets louder if the animal gets excited or exercises a bit.
And signs of actual heart failure.
If it's progressed to left heart failure, you'd see the signs we mentioned: fast breathing, tachypnea, more effort to breathe, maybe crackles in the lungs on listening, even bluish gums if it's really severe.
Got it. And for tricuspid valve dysplasia, what are the exam findings?
Similar murmur idea, but this time it's loudest over the right side of the chest near the apex.
Apex.
Yep. And again, you might feel a thrill or hear a gallop with severe disease. But interestingly, in cats, The text mentioned you can have significant tricuspid regurgitation leakage that's completely silent. No murmur.
Really? That's not...
Well documented in cats, yeah. You might also see the jugular veins in the neck looking distended, maybe even pulsating.
Okay.
And if right heart failure is present, you'd look for fluid in the abdominocytes and sometimes, though rarely, swelling in the legs, peripheral edema.
So, listening carefully in a thorough exam are key first steps. How do vets confirm the diagnosis? What about ruling other things out?
Good point. Differential diagnosis is important. An older dog with a murmur might just have degenerative valve disease, which is acquired, not congenital.
Right.
A right-sided murmur could also be a ventricular septal defect, a hole between the lower chambers, and a swollen belly could be liver disease or other things, not just right heart failure.
True.
Oh, and for that dynamic outflow obstruction, sometimes giving a beta blocker medication can help tell mitral dysplasia apart from hypertrophic obstructive cardiomyopathy, which is a different muscle disease.
Interesting diagnostic trial. Okay, imaging, x-rays, what do they show?
Chest x-rays give you a good overview. For mitral dysplasia, you might see the left atrium and ventricle are enlarged if it's insufficiency. Or maybe just the left atrium is big with stenosis. Perhaps only mild left atrial enlargement with outflow obstruction. And if there's left heart failure, you'll see signs like enlarged pulmonary veins and fluid in the lungs.
And for tricuspids?
You'd look for right atrial and ventricular enlargement with insufficiency, maybe a generally rounder heart shape, isolated right atrial enlargement with stenosis, and signs of right heart failure like a big caudal vena cava, enlarged liver and spleen, maybe a site's visible.
So x-rays give clues about chamber size and failure, but the real detailed look comes from echocardiography, the heart ultrasound.
Oh, absolutely. Echo is crucial. It gives you live moving images. For mitral insufficiency, you can see the dilated left atrium, the enlarged, thickened left ventricle.
That eccentric hypertrophy.
Exactly. You can often see the valve leaflets themselves look abnormal, thickened, maybe little muscles controlling them look flattened. And Doppler lets you see the blood leaking backward and even estimate how bad it is.
Okay. And for mitral stenosis?
Echo would show a big left atrium, but a normal or maybe even small left ventricle. The valve leaflets might look thickened, fused, not opening well. Doppler measures the high-speed blood flow through that narrow opening, and it helps rule out that rare thing, core triatriatum, sinister and extramembrane in the left atrium.
Gotcha. And the dynamic outflow obstruction?
On echo, you can actually see that front mitral leaflet moving towards the septum during systole. You measure increased blood flow speed leaving the ventricle, and you can see and measure the thickened left ventricular wall, the concentric hypertrophy.
Echo sounds incredibly informative. What about seeing tricuspid dysplasia with it?
Same principles, just on the right side. Leaky valve, dilated right atrium, enlarged right ventricle. The valve itself might look fused, sort of curtain-like. Doppler shows the regurgitation.
And tricuspid stenosis?
Big right atrium, normal or small right ventricle. Thickened leaflets that don't open properly, high velocity flow through the narrowing on Doppler. Echo also helps assess if there's leakage happening at the same time or if there's that shunt between the atria we talked about, and it helps rule out the right-sided version of that membrane issue, core triatriatum dexter.
It really seems like echo is the gold standard for diagnosis here. The text also mentioned cardiac catheterization, though. Is that common?
Not routine, no. It's invasive threading tubes into the heart via blood vessels. It's usually reserved for cases where echo is unclear, or maybe if surgery is being seriously considered.
What does it tell you?
It allows direct measurement of pressures inside the heart chambers and major vessels. You can also inject contrast dye to visualize blood flow patterns very clearly. What you measure depends on what you suspect, mitral versus tricuspid, leak versus narrowing.
Okay. And lastly, diagnostics ECGs. Electrocardiograms.
Yeah, ECGs mainly reflect the chamber enlargement that's happening, so you might see patterns indicating left atrial enlargement or right ventricular hypertrophy and so on.
Can they show arrhythmias?
Yes, definitely. In more severe AVVD, you might pick up atrial premature beats, runs of fast heartbeats like supraventricular tachycardia, or even atrial fibrillation.
Okay, so we've got the diagnosis. How do we treat AVVD?
First off, if an animal is in active congestive heart failure, they need inpatient care, hospitalization to get stable.
Makes sense.
And client education is huge. Owners need to understand the potential heritability, especially in those predisposed breeds, and really be advised against breeding affected animals.
Right, preventing future cases. What about diet?
Sodium restriction is usually recommended if CHF is present or seems imminent. Less salt helps manage fluid retention.
And surgery, you mentioned that earlier.
Yes, valve repair or even replacement is possible, but it's complex surgery done at highly specialized centers. Not widely available or always feasible.
What about for stenosis?
For stenosis, sometimes balloon valvuloplasty can be an option. They use a catheter with a balloon to stretch the narrowed valve open.
Okay, so more commonly it's about managing with medications.
For many cases, yes, medical management is key, and the approach depends on the specific problem.
So for insufficiency, the least causing CHF.
The cornerstones are usually diuretics, like furosemide, to remove fluid, ACE inhibitors, which help blood vessels relax and reduce strain on the heart, and pimobendin, that's a drug that helps the heart muscle contract better and also dilates blood vessels. If there are fast supraventricular arrhythmias like atrial fibrillation, a drug called digoxin might be added to help control the heart rate.
And what if the main problem is stenosis, the narrowing?
Diuretics are still used if there's fluid buildup, like pulmonary edema or ascites, but a big focus is often controlling the heart rate.
Why is that?
Allowing the heart more time to fill between beats can improve output when the opening is narrow. So drugs like digoxin again, or calcium channel blockers like diltiazem, or beta blockers like atenolol might be used. The goal often is to get the resting heart rate down, maybe near 150 BPM in dogs.
Got it. And for the dynamic outflow tract obstruction?
Beta blockers like atenolol are the main treatment there. You carefully adjust the dose to try and lessen the obstruction that happens when the heart pumps.
Sounds like careful monitoring of these meds is essential.
Absolutely crucial. You need to watch for side effects, kidney function changes with ACE inhibitors or diuretics, potential toxicity with digoxin, things like that.
And follow-up, how often do these pets need checkups?
If they're stable, no signs of CHF, maybe a yearly recheck with echo is reasonable.
But if they've shown signs of CHF?
Much more frequent follow-up. The texts suggest at least every 3 months, often including repeat chest x-rays, ECG, and echo to monitor progress and adjust meds.
And the key prevention point again.
Avoid breeding affected animals, especially in breeds known to be predisposed.
Right. What are the main complications we worry about down the line?
The big ones are progression to congestive heart failure, left-sided from mitral issues, right-sided from tricuspid. Collapse or syncope, especially with exercise, remains a risk. And developing significant arrhythmias like paroxysmal supraventricular tachycardia or atrial fibrillation, particularly if the atria become very enlarged.
So what's the overall outlook, the prognosis?
It really depends on the severity of the specific valve defect. The texts are clear. For animals with serious malformations, the prognosis is generally guarded to poor.
Well, this has certainly been a deep dive into atrioventricular valve dysplasia. It's clear from the sources this is a really complex congenital issue.
Definitely. So many variations in how it presents, the severity, the consequences.
And it just highlights how vital that accurate diagnosis and careful ongoing management really are for these animals.
Absolutely. And understanding these intricate developmental problems really underscores, the importance of continued research in veterinary cardiology and genetics to help these pets.
Exactly. And maybe here's a final thought for you listening. We talked about the genetic link in some breeds for AVVD. It makes you wonder, what are the broader ethical questions around breeding practices when we know certain congenital conditions are passed down?
Yeah, that's a big question in animal welfare and veterinary medicine.
Definitely something worth mulling over as we learn more. Thanks for joining us for this deep dive.